Please take your seat, sir. Okay, sir. Before going on further, okay, good morning. Okay, I'm BEREWINSE KUMAR SELVAKKUMARAN and I'm a medical student. So, may I ask your consent to do some checkups and ask you some questions?
Okay.
Yeah. Okay, thank you, sir. The procedure that I am going to do to the patient is as below. Firstly, I'm going to do the radial pulse assessment, and then I will do the respiratory rate assessment, and lastly, I'm going to get the blood sample for the investigation. So, may I know your name?
My name is Novesh Kumar, son of SELVAKKUMARAN.
Novesh Kumar, SELVAKKUMARAN. And may I know your age, sir?
I'm 40 years old.
You're 40 years old. Okay, what is your occupation, sir?
I'm working as a manager in a 5-star hotel.
Manager in a 5-star hotel. Okay. So, sir, if you don't mind, may I know the reason why you came to hospital today?
I'm having chest pain for the past 1 month.
Oh, chest pain for the past 1 month. Okay. Do any other family members had this chest pain before?
And my uncle.
Your uncle. Okay. May I know his age?
He passed away at 70 years old.
Oh, passed away.
Due to heart attack.
Oh, due to heart attack. Okay, 70 years old. Okay. So, do you have any habit of exercising?
No, very rare in my life.
No, very rare. Okay. Okay, sir. Another question. If you don't mind, do you have any habit of smoking?
Yes, I'm a regular smoker.
You're a regular smoker. Okay, sir. Thank you. Now, I'm going to explain the steps for the radial assessment. Firstly, sanitize the hands before the procedure. Lightly press the 3 middle fingers of the wrist of one hand on the patient's left wrist just below the thumb. Count the number of beats for 1 minute. Sir, could you place your left hand on the table, please, forward? Okay, thank you, sir. Okay. Done, sir. The pulse rate of the patient is 110 beats per minute, which means abnormal. The normal rate of the pulse rate is from 60 to 100 beats per minute. So now, I'm going to explain the steps for the radial assessment. Firstly, ask the person to sit upright. Try to count the patient's respirations without his knowing. If he knows, he may try to control his breathing. This can give a false respiratory rate. Use a watch with the second hand and count his breath for 60 seconds. Use any of these following methods to count. Look at his chest rise and fall. One rise and one fall are counted as one breath. Okay, so could you sit straight upright? Okay, thank you, sir. Thank you for the cooperation, sir. The patient's respiratory rate is 14 beats per minute, which is considered normal because the normal respiratory rate ranges from 12 beats per minute until 20 beats per minute. Sir, do you have chest pain?
Yes, I have.
Okay. Do you feel like your heart is like pumping faster? Like it's not a normal heartbeat?
Yes, I feel.
You feel like your heart is pumping faster? Okay, yes. Okay. Do you feel any breathing difficulties sometimes?
Yes, sometimes.
Yes. Okay. Then, do you feel like some of your body parts is swelling?
Yes.
Swelling. Yes. Okay. Do you sweat during your sleep, like night time? Do you sweat?
Yes, I have.
Sweat. Okay. Do you feel numbness? Numbness is like you cannot feel the pain.
No.
No, you don't have numbness. Okay. So, now I'm going to explain about the auscultation point of the pulmonary valve, aortic valve, tricuspid valve, mitral valve and the apex of the heart. So, before that, we have to know where these valves and the apex of the heart are located. So the orange color indicates the surface and the yellow color indicates the auscultation point. Okay, so this first orange color, which is located on the third costal cartilage, is where the pulmonary valve is located, and the second is the third intercostal space at the left sternal border, is where the aortic valve is located, and this, the fourth costal cartilage at the left sternal border, is where the mitral valve is located, and here at the fourth intercostal space at the mid-sternal, where the tricuspid valve is located. Okay, and then at the fifth intercostal space near the middle clavicle line, where the apex of the heart is located. So now we move on to the auscultation points of these valves and the apex of the heart. Okay, so the auscultation point for the aortic valve, which is on the right side of the second intercostal space, where the pulmonary one is the left one, the second left intercostal space, and the aortic one is the second right intercostal space. Okay, and then this is the auscultation point for the tricuspid valve, where this is at the left fifth intercostal space, just lateral to the sternum. This is the auscultation point of the tricuspid valve, and this is the auscultation point for the mitral valve and the apex of the heart, which is fifth left intercostal space near the mid-clavicular line. Okay, so now I would like to explain about thalassemia to you. Okay, so thalassemia, okay, it's related to our red blood cell. So this red blood cell is function as to carry the blood and oxygenated blood to the tissues, so that tissue get oxygen. Okay, so in thalassemia, the major part of red blood cell is known as hemoglobin. So this hemoglobin made up of some chains, which is known as alpha chains or beta chains. So if there is a defect in the alpha chain, it is known as alpha thalassemia. Okay, and if it is defect in the beta chain, it is known as the beta thalassemia. Okay, so let's say mother is a thalassemia patient and father is a carrier. So that means she has both thalassemia gene, and this one, father has one thalassemia gene and one normal gene. It happen equally to the boys and the girls. So when they both get married and they get children, so it's inherited to generation, and usually symptoms of thalassemia is quite serious sometimes. You feel often tired, sometimes growth retardation may occur, people can grow, and then sometimes you feel tiredness easily, failure, and then you can get dark urine too. So these are the symptoms of the thalassemia usually. Now I'm going to explain the steps to get the blood sample for investigation. So this process will just involve a small needle inserting into one of the veins of the arm. It might be uncomfortable but not painful as you think. So for this process we will be needing tourniquet, gauze, blood collection devices, alcohol swab, plaster and sample tubes. So firstly, wash hands and inspect for a suitable vein. Apply a tourniquet and palpate the vein. Wash hand again and wear an apron and use gloves. Clean the site and allow it to dry in circulation motion for 30 seconds. Anchor the vein from below using your tongue. Insert a needle at an angle of 30 degrees or less. Observe the flashback. Anchor the needle to the patient's skin. Fill the sample bottles. Release the tourniquet and remove the needle. Apply pressure using a gauze. Dispose of shafts appropriately. Apply the plaster and remove glove, apron and dispose all the clinical waste appropriately. And finally, thank the patient for their cooperation.